So do you know that hepatocellular carcinoma is the third most common cancer-related death in the worldwide? And hepatocellular carcinoma also comprises 5% of cancers in globally. That means human-related cancers globally. That means out of each 20 human cancer, one cancer is hepatocellular carcinoma. But still, this is not the most common cancer which is seen in the liver. The most common cancer which is seen in the liver is metastasis or secondaries. That means they are arising somewhere in the body and then they are coming to the liver. And they usually come from gastrointestinal tract like colon. They can come from the breast. They can come from the lung. So please keep in mind that the most common cancer or the most common malignancy seen in the liver are metastases or secondaries. But the most common primary cancer or primary malignancy which arises in the liver is hepatocellular carcinoma. At this juncture, I would like to give you a brief idea about the classification of the liver tumors. Liver tumors, like any other organ, primary tumors could be divided into benign liver tumors and the malignant tumors which are originating from the liver. In the benign liver tumors, I would like to focus on only two things that you need to know, two particular benign liver tumors. One is hemangioma, cavernous hemangioma, and second is hepatocellular adenoma. Just keep these two benign tumors which originate in the liver in your mind. And cavernous hemangioma, the most important aspect that this is the most common benign tumor which originates from the liver. So the most common benign tumor which originates in the liver is cavernous hemangioma, and the most common malignant tumor or cancer that originates in the liver is hepatocellular carcinoma. Please keep in mind. And the most common cancer which is seen in the liver is metastasis or secondary. These three important concepts are often confused and you need to keep them in your mind. Now, coming back to the cavernous hemangioma, as I mentioned, its most important significance is the most common benign tumor which originates from the liver, and sometimes radiologically they're accidentally detected and they could be confused with some metastasis or the tumors in the liver. That is their only significance. Coming to the hepatocellular adenoma is another notable benign tumor which arises from hepatocyte, and its significance is this, that before the arrival or the advent of oral contraceptive, this tumor was largely unknown, and now it has been found to be strongly associated with exposure and common in those females which have been exposed to oral contraceptives. And this tumor has also been associated with uses of anabolic steroids. So remember, please keep this in mind, that this is a tumor, liver tumor, hepatocellular adenoma, which has been associated with exposure to oral contraceptives and exposure to anabolic steroids. Another key concept about hepatocellular adenoma, that sometimes they could, particularly during the pregnancy, they may increase in the size and they could rupture and cause intraperitoneal hemorrhage and emergency. This is another key concept that you need to know about hepatocellular adenoma. Now, coming to the malignant tumors of the liver. Malignant tumors of the liver could be many, and they could arise from the many parts of the liver. Some of them they could arise from the vascular part of the liver like angiosarcoma. Some of them they could arise from the hepatocyte or hepatic stem cells like hepatocellular carcinoma. In the children, we can see a particular type of liver cancer known as hepatoblastoma. The liver has intrahepatic bile duct. From them they could arise intrahepatic cholangiocarcinoma. Then there is epithelioid hemangioendothelioma. So all these malignant tumors which I mentioned, they can arise from the liver, like hepatocellular carcinoma, hepatoblastoma in children, intrahepatic cholangiocarcinoma. Cholangiocarcinoma means it's a cancer which arises from the cholangiocyte or bile duct. And then there could be angiosarcoma, and then there could be epithelioid hemangioendothelioma. So all these cancer could arise from the liver, but the most important one and the most common cancer which arises from the liver primarily, that is hepatocellular carcinoma. And now I'd like to focus on hepatocellular carcinoma. Hepatocellular carcinoma, as I mentioned, is a very, very important cancer. It roughly comprises 5% of the cancers in the human beings. But their incidence varies from part of the world. Like some part of the world, particularly in the eastern part of the Asia like China and sub-Saharan Africa, the incidence is far more common, because this area Previously, there was a lack of vaccination, particularly the hepatitis B vaccination, and that's why the incidence was very high. But particularly now in the Asia, due to the advancement in the healthcare settings, that incidence is decreasing. And in the Western world also, now the incidence of hepatocellular carcinoma is increasing because due to the arrival of a lot of cases of hepatitis C, chronic hepatitis C. So nowadays hepatocellular carcinoma can be seen in anywhere in the world, but there is a difference. If you see in those part of the world where the hepatitis B or C is endemic, the incidence of the appearance of hepatocellular carcinoma typically arises earlier, 20 to 40 years of age. But in cases of Western population, usually see hepatocellular carcinoma after 60 years of age, typically in a patient with a history of cirrhosis. This is the basic difference. Now there is a lot of known risk factor for the development of hepatocellular carcinoma. One is having preceding history of chronic hepatitis B infection, chronic hepatitis C infection. There could be some metabolic liver disorders which can act as a risk factor for hepatocellular carcinoma, like hereditary hemochromatosis, which is usually results in toxic iron overload and associated with HFE gene mutation on chromosome 6. There could be alpha-1 antitrypsin deficiency, which can also act as a risk factor for development of hepatocellular carcinoma. There could be Wilson disease, which can also pose as a risk factor. Tyrosinemia could also as a risk factor. Metabolic syndromes and the associated things. Now the researchers are focusing on this as a risk factor for the development of the hepatocellular carcinoma. So there are many risk factors for the hepatocellular carcinoma that you need to keep in your mind. This is a very important concept. Now coming to tumor marker for hepatocellular carcinoma, we typically use a tumor marker known as alpha fetoprotein, which is act as a very popularly used tumor marker for hepatocellular carcinoma. But the point is, the key concept is that in early lesion, in smaller lesion, the alpha fetoprotein may not be elevated, and there is certain variant like fibrolamellar variant of the hepatocellular carcinoma. In this variant, AP level would not be elevated. Only in 7 to 11% cases of fibrolamellar variant of HCC, there is elevation of the alpha fetoprotein. So just keep in mind that not all cases of hepatocellular carcinoma, the AP level is elevated. On the other side, in chronic liver diseases, also the AP level may be elevated. So there are many non-cancerous conditions where AP level would be elevated. Please keep this concept in your mind. Now coming to other tumor markers, they have also been used for hepatocellular carcinoma. One is DCP, des gamma carboxyprothrombin. Des gamma, D for des gamma, carboxy, C for carboxy, and P for prothrombin is also used as a tumor marker for HCC other than alpha fetoprotein. This you need to keep in mind. Coming to their morphological appearance, morphologically grossly they can usually show three kind of appearance. One, they could be a unifocal large mass, which is a typical appearance. Then there could be a multifocal small masses, or there could be diffusely infiltrating. This kind of three characteristic gross appearance you can see on the gross specimen. And hepatocellular carcinoma, another important feature in the gross, that they can show a little bit greenish appearance, because this is a cancer where the cancer cells can exclusively synthesize bile, which is a characteristic feature of hepatocellular carcinoma. Microscopically, what you see that is a gross effacement of the normal liver architecture. You don't see the normal acinus pattern. Rather, you can see two characteristic patterns. One is known as trabecular pattern. Keep this in mind. Another is pseudo-acinar pattern, where they try to form acinus-like structure, but not really they can form in that way. Their presentation is variable. They can present with some generalized feature, with weight loss, cachexia, features of gastrointestinal hemorrhage, peritoneal hemorrhage. This kind of features could be seen, but often the features, particularly if they're occurring in the backdrop of chronic hepatitis or cirrhosis, the features would be masked by their features. So there's no specific set of features which are associated with this. Diagnosis is often made by radiologically, because radiologically they could show certain characteristic feature in arterialization, and biopsy may not be always used for their diagnosis in this condition. So these are all the key features of the hepatocellular carcinoma. I'll continue about the liver tumors in the coming Insta lecture session. Thank you very much.